Antimicrobial resistance, or AMR, happens when bacteria, viruses, fungi, and parasites stop responding to the drugs designed to kill them. Antimicrobial resistance is a growing threat worldwide. To confront AMR, researchers need deeper insight into how people engage with antimicrobials, health systems, and other people. Gender vulnerabilities and other inequalities can put some groups at greater risk for AMR infections. For example, through greater microbial exposure or differences in treatment access. In some households, particularly in low and middle-income countries, women have less say in financial decisions, which hamper their ability to access medication. Where masculinity is associated with toughness, men may avoid being seen at healthcare clinics or purchase antibiotics from informal providers. And in small-scale farming communities in some countries, livestock vaccines may be inaccessible to small holdings, which are more likely to be run by women. This puts animals at risk for preventable diseases, driving the misuse of antibiotics and endangering women's livelihoods and health. By accounting for how gender norms and other social factors affect AMR in particular contexts, researchers can produce more accurate, relevant, and impactful research. For example, an intervention to improve the distribution of livestock vaccines in a rural community will be more effective if it also considers gender-related barriers to vaccine uptake. By addressing the underlying causes of AMR and food insecurity in that context, this approach also empowers local women farmers. In a novel project, gender and AMR researchers have collaborated to create a practical guide for integrating gender and equity considerations throughout the research cycle. This user-friendly resource outlines steps towards more inclusive and socially responsive research. 2 detailed case studies illustrate how researchers can apply the concepts in different settings. The resource is structured around the AMR research and innovation cycle, sharing practical ideas for applying a gender and equity lens in each stage. Step 1. When defining the research problem, it's important that researchers question how gender and equity might be relevant to their research topic. The resource provides a clear framework for conducting a gender equity analysis and uncovering relevant considerations. Step 2. During proposal development, the focus shifts to integrating gender and equity into the study design. This includes determining who is included in the research team, what the research is asking, and how the team approaches data collection and analysis. Step 3. When implementing the study, considering gender and equity factors can help to ensure unbiased results. Are sample sizes big enough to capture diversity in the data? And has the research team taken steps to facilitate women's full participation in the study? For example, mobile clinics can make it possible for women to participate close to home, reducing travel time and costs. Step 4. Here the guide encourages researchers to think about useful ways to slice the data. A gender and equity lens can help to bring findings into greater focus. For example, if a study finds that women use fewer antibiotics than men, researchers could explore how other factors, such as race, age, or socioeconomic status, interact with gender to produce these differences. A qualitative analysis could investigate underlying social reasons, such as differing access to financial resources or information. Step 5. During this step, researchers should consider how to communicate their work to affected communities. They might consider consulting representatives from the beneficiary groups to produce engaging and relevant communications. Finally, the document encourages researchers to gauge whether the dissemination materials reached all the intended groups. The Pathways document is freely available for download. Whatever your role in AMR research and wherever you are in the research cycle, it can help you to identify strategies to make your work more relevant and impactful.